Thanks so much for joining us again at this week for our show, We Are All in This Together. And continuing on that theme of We Are All in This Together, we're looking at psychosocial support and looking after ourselves and our community during this time. So on that note, I'm speaking with Salon McDonald. He's the Social Innovation and New Business Director at the Trinidad and Tobago Red Cross. And he joins me now today, which is great. Thank you so much for coming out and participating in this program today.
Thanks a lot for inviting me.
This is really great. So when we look at some of the programs Trinidad and Tobago Red Cross is doing, they are doing stuff around what we call psychosocial support. Can you speak a little bit to that programming?
What we've been doing thus far in the face of all the challenges we've met with COVID-19 is providing the community with various kinds of psychosocial support. We've done that by opening lines that, lend support to the community in a number of ways. We have one open line which provides, people call in directly and speak to individuals who, whether you have questions on COVID-19, whether you would like to speak with someone on facing any number of the challenges that you now have to deal with. Curtailed movement sometimes has people anxious and not sure how to respond. The level of uncertainty that's taking place with institutions closed and organizations not operating as per usual, or simply being in the same place with people who you haven't been in the same place for extended periods of time with for quite some time, and the challenges that presents. We also provide support to people who are in the decanting facilities who have tested positive, but who are on the way home, and you have to go through the midway period, getting you used to going back, getting some idea of what's happened after you've faced the challenges of illness, and you now have to go back and function within your homes, as well as providing our frontline workers and emergency personnel with psychosocial support, because of the fact that there's nothing that's ever happened like this in Trinidad and Tobago before, even the wider world. So being able to provide the service that you do as an essential, but also keep your own mind and body intact as you face some challenges and maybe some sites that were not part of your regular everyday routines.
So what kinds of things are you hearing when people do call? Like, what are they saying or what are they asking? Is there anything that comes up often?
Pretty often people are asking what next. They're not sure what they're going to do, what's going on with their jobs, what's happening with their children. We have a strong exam-based culture in Trinidad and Tobago. So people want to know what's going to happen with their children and their education, the movement of exams and displacement. And people are also uncertain about, basic information about COVID-19. What's the share? What's the spread? Why do we have to stay inside? What's going on? As well as some people who have been displaced in some way. They want to find out, who do we call? What do we do? What kind of social redress is possible?
And what kinds of advice are the Red Cross able to give them?
Well, thus far, we've had a number of different kinds of advice coming. We've helped people to, get into their routines so that things aren't as terribly disturbed as they are, but not just for the adults, but for the children, because the children are also a strong part of having to deal with this. No child has ever had to deal with this before. So we're helping with that. We're looking at how to stay healthy physically and mentally and emotionally. So getting your exercise in. We're also advising on different platforms that people can use. We're accustomed to going outside. We're accustomed to meeting people or going to their houses. And a lot of people aren't familiar with some of the apps that are available, that you can lend support to, or that you can exercise in the group, or that you can have meetings and classes. We also look at how to help people deal with the overload of information. So we're looking at, understand that you don't need to know everything, and it's impossible to know everything. And you have to sift what you let into your mind space. So sometimes maybe you don't want to look at every news briefing. Maybe you don't want to look at every video that shows the death rate across the world, or whatever the case might be, or how dire it is. Sometimes you want to change that diet that you let in. Watch a comedy, do something that your whole family will enjoy, and look at those means and measures that allow people to connect without being physically present in the same space.
That's all really, really good advice. But I mean, that's not the only thing that TTRC is working on. I mean, you've got a number of initiatives around COVID going on. Can you briefly touch on some of those?
So some of the things that we've been doing are basically supporting our local effort in combating the virus and helping people to, cope and normalize. So we are supporting various government ministries in screening for socially displaced persons who are also impacted. We're helping the Ministry of Health with contact tracing, because as you well know, a part of maintaining our security barrier, if we can call it that, is finding out people who have tested positive or who are suspected of being in contact with the virus, to be able to let us know where you've been, what you're doing, and so forth, and help with the collection of data and the support of that. We're also looking at how we can create various materials. One of the challenges that we have is that we are not deliberately an inward facing community, as in we're accustomed to outward things. We look for external sources of entertainment. We look for hosts and mediums who will be able to provide us with a means of focus. But what we've done is look at creating materials that help us focus inwardly, to simply ask, how do you feel? And looking at the various kinds of materials that help you do a personal check-in. And that's available across multiple platforms, both physically and digitally, so that we can get people into the idea of do your own temperature check, do your own emotional, do your own where are we now, so that you have an idea of how you're feeling and if you need to reach out.
That's really, really good advice. Juan, thank you so much. And just to reiterate a couple of the things he said, I mean, it's about taking care of yourself while taking care of the people around you. So like you said, good exercise, eating properly, knowing when you've heard enough bad news, knowing when you need to reach out and talk to someone, keeping an eye on your kids, making sure you're talking to them. As he said, there's lots of resources out there in Trinidad and Tobago, but also through the Red Cross in your country. So reach out, see what kind of resources are available to keep yourself healthy during this time, because it's really important that it's not just physical health, it's mental health as well.
Very true.
Thank you so much again, Salon from Trinidad Tobago Red Cross.
Thank you very much.
I do communications with the Federation of the Red Cross and Red Crescent here in the Caribbean. Every week we're doing this program. We are in this together. We are in this together. And if you have questions or you're hearing misinformation or you have rumors that you want to have set straight, please let us know. We want to be able to tackle some of those. We want to be able to make sure we're getting the right information out there, because that is another piece in keeping us healthy and happy. So thank you so much for this.
And thanks for the invitation, Angela. All right, take good care. And remember, we're all in this together.
We are in this together. Thanks very much.